Well, we're looking at some health headlines this morning with WGN Morning News medical contributor and Northwestern medicine physician, Dr. Lauren Streicher. Good morning.
Good morning.
Good morning.
All right, let's start with a new study about race and cardiovascular disease.
Yeah, this was a huge study. Black women are more than 2 times more likely than white women to develop cardiovascular disease, and black men are more than 1.5 times more likely. So the question has always been, is this genetics, is this biology, or is this something else? So this is a very large study out of Northwestern Medicine. A group of cardiologists followed 5,000 people for over 30 years to see precisely who was it that developed cardiovascular disease. And there are both black and white men and women in this study. And what they found is that it has nothing to do with race. It has nothing to do with genetics. This is all social problems, things like poverty, education, diet. And what this really does, and I spoke with one of the main investigators, Dr. Nilay Shah, who pointed out that race is a social construct. It is not a biologic construct. And this really emphasizes the fact that genetics has nothing to do with this. So this is good news because you can't change your genetics. But what it really tells us is that we have to do a much better job as a society to get rid of these racial disparities when it comes to things that are going to lead to major health problems. But this was big because this is a topic that in medical circles has been a question. You know, is this genetic, biologic, or is it just all these other factors?
All right, next topic, allergies resolve themselves by age 6.
Yeah, this was another big study. This one was out of Australia. And of course, a lot of kids have food allergies, and it's more than an inconvenience for these parents to avoid the foods because, of course, these allergies can be life-threatening. Now, most of these allergies start in the first year or 2 of life, and the 2 most common allergies are egg allergies and peanut allergies. So this study followed a large group of kids, 5,000 kids, over 6-7 years to see how often did these allergies just go away on their own, and can you predict who it would go away? Because that's what the parents want to know, of course. And what they found is that when it came to the egg allergies, 90% of these kids no longer had an egg allergy by age 6. Peanut allergies, not as good news, but it was 1/3. 1/3 of kids no longer had peanut allergies by age 6. And when they looked at predicting which kids were going to get rid of the allergies, it turns out that the kids that have more than 1 allergy or that also have eczema are the most likely to not get rid of the allergy. So what this really tells you is if your child has an allergy, have them retested every year.
All right, next one, some smokers don't get lung cancer, and genetics might explain it.
Yeah, this was really interesting. You know, lung cancer worldwide is the #1 cause of cancer deaths in men, the #2 cause in women. And while certainly people get lung cancer who don't smoke, the #1 risk factor for getting lung cancer is smoking. And in fact, 90% of lung cancers are in smokers. But you know, we can all turn to that person that we say, wait a minute, this guy smoked 3 packs a day and he lived to 100. What's the deal? Did they just get lucky, or is there something different about this person? And now we know that there does seem to be a genetic predisposition. So specifically, we know that smoking causes there to be genetic mutations in the cells in the lungs, which predisposes to cancer. But some people have a genetic predisposition that they don't get those mutations. So this is important not to say it's okay to smoke. Obviously it's not, but it's really going to help researchers in terms of figuring out how to treat lung cancer with this better understanding of who gets it and who doesn't get it.
All right, Dr. Streicher, thanks for being with us.
Thank you.
For more, check out Dr. Streicher's podcast, the Menopause Podcast.
Hey, Mike.
Hey, son of